So Vermont's early care and education system is considered what we call a mixed delivery system. And that's defined by the Every Student Succeeds Act as a system of early childhood education services that are delivered through a combination of programs, providers, and settings. And that may include Head Start, licensed family and center-based childcare programs, public schools, and community-based organizations. And this system is supported by a combination of public and private funds. This approach is considered a national best practice because it's improving access to high quality services. It supports family choice in providing this range of options through settings. And it's really important in a rural state like Vermont. It also builds our capacity to serve a greater number of children. So the next couple of slides are going to show us the current status of our mixed delivery system. So the current slide shows us a little bit about regulated early childhood education settings. So as of December 2021, there were 16,381 children enrolled in regulated early childhood education programs. And the majority of those children were receiving care in center-based programs. You can also see here that the number of preschoolers enrolled is higher than the number of infants and toddlers. As we're thinking about quality and access in this mixed delivery setting, 76% of infants, 54% of toddlers, and 52% of preschoolers that are likely to need care do not have access to high quality programs. Our partners at Let's Grow Kids have reported that in order for Vermont to meet the estimated demand, approximately 9,000 new childcare slots are needed, and that a lot of those, over half of those, would be dedicated towards infants. As we're thinking about building a truly comprehensive system of services for infants, toddlers, and our early childhood system, it's important not to forget about after school and out of school time care. So according to our partners at the After School Alliance, in 2020, there were 19,092 children in after school programs in Vermont. But they also found that if an after school program were available to them, over 26,000 of Vermont's children would likely participate. It's also important to mention some of our wraparound services that we have in Vermont. This is not on your slide deck, but in terms of those wraparound services, there's so much support that children and families are receiving through programs like Children's Integrated Services, the Parent-Child Center Network, Head Start and Early Head Start, and Reach Up. So we want to bring you back to the report for information on the number of children served in those programs, as well as the impacts of those programs. So as we move through this mixed delivery system, I want to draw your attention to universal pre-kindergarten education, which is coming through Act 166. And this is providing access to 3, 4, and 5-year-olds not yet enrolled in kindergarten, access to 10 hours a week of universal pre-kindergarten education in school-based or private programs. And so what you're seeing here is an overall trend for enrollment. And what you're seeing in 2020 and 2021 is that that was when the pandemic hit. So we see a slight drop in enrollment in that year. And in 2022, you're seeing that rebound a little bit up to about 7,500. So we're not quite back to pre-pandemic levels, but we are working with our agency leaders at both agencies to examine the current enrollment and capacity trends for our public and private programs to see what we need to be thinking about coming into this legislative session. Next, I want to draw your attention to one of the key outcomes that we use in the early care and education system to understand the impact of services. And that's third grade math and reading. So on the far left of this visual, we're seeing that 41 and 42% of all students were proficient or above in math and reading, respectively. However, those proficiency rates are varying significantly by child and family characteristics. So for example, the percentage of children who are considered historically marginalized, it's much lower than the percentage of students considered historically advantaged.